with carbon monoxide poisoning. So, regarding carbon monoxide poisoning, we have discussed regarding the transport of oxygen, and while studying about transport of oxygen, I think you have maybe remembering about these three different ways for transporting oxygen, as carbonic acid, as bicarbonates, and as carbaminohemoglobin. And one peculiarity of the hemoglobin is that hemoglobin has a higher attraction to carbon monoxide. So if there is both oxygen and carbon dioxide present in an environment, hemoglobin will always bind with or attach with the carbon monoxide. So that is an important peculiarity of hemoglobin. So if there is a little hemoglobin in this room, our little carbon monoxide in this room, our hemoglobin will be binding with this carbon monoxide. That's the problem. That means we will be facing a lack of oxygen. So this is the problem of carbon monoxide poisoning. In presence of carbon monoxide and oxygen, hemoglobin will always bind with carbon monoxide, thereby creating a situation in which our body may not be able to get sufficient quantity of oxygen. So our body will be facing a lack of oxygen. Second problem is that this binding of carbon monoxide with the hemoglobin will be producing a substance called carbaminohemoglobin, I think a carboxyhemoglobin. And this carboxyhemoglobin can also create a lot of side effects. So this is the problem with the carbon monoxide poisoning. Here you can see that while carbon dioxide can readily associate and dissociate from hemoglobin, other molecules such as carbon monoxide cannot. That is, there are two types of oxides. One is carbon monoxide and carbon dioxide. With regard to carbon dioxide, even though there is an extra oxygen in that, it can easily attach to a hemoglobin molecule and also detach from a hemoglobin molecule. So binding and removal from a hemoglobin molecule is very easy. But in the case of a carbon monoxide, once it is binding with the hemoglobin, that attachment with the hemoglobin is very strong. So that is the problem with the carbon monoxide. Here you can see that carbon monoxide has a greater affinity. The meaning of the word affinity means attraction. So carbon monoxide has a greater affinity for hemoglobin than does oxygen. So that is the problem. So therefore when carbon monoxide is present, it binds with hemoglobin preferentially over oxygen. Preferentially means hemoglobin will be giving first preference to carbon monoxide. That is the meaning of the word preferentially. As a result, oxygen cannot bind to hemoglobin, so very little oxygen is transported through the body. So this is the problem of carbon monoxide poisoning. The problem with the carbon monoxide is that it is very difficult to detect. It is colorless gas, odorless gas, so there is no color, there is no smell. So it is almost very difficult to detect this. It is produced by gas powered vehicles and tools. For example, from the vehicle exhaust, smoke exhaust coming out of a bus or a lorry, that will be containing a lot of carbon monoxide. So these are the normal sources producing carbon monoxide. And carbon monoxide can cause headaches, confusion, as well as nausea. This nausea means vomiting, and long-term exposure can cause brain damage or death. So this is the problem of carbon monoxide poisoning. Here you can see, I will show you that. So what is the remedy? In the remedy, it is giving 100% pure oxygen. So if a person has taken a lot of inhaled a lot of carbon monoxide, what doctors are usually doing is that doctors will be administering or giving him lot of pure oxygen, 100%. Normally our air is only 29% oxygen. So instead of that, we are giving 100% pure oxygen to the patient to breathe, and that will speeds up the separation of carbon monoxide from hemoglobin. Now I will show you how carbon monoxide poisoning um, works. See, I will show you some pictures also. Here you can see that. See, these are some of the problem. What happens in this carbon monoxide poisoning, mild exposure, medium exposure. See, in a very severe form of carbon monoxide poisoning, that will be leading to unconsciousness, cardio respiratory failure, and eventually death will be there. Here also you can find what are the symptoms. Basically it starts with the headache, fatigue, then slowly leading to finally leading to the death of the person. So these are some of the problems associated with the carbon monoxide poisoning. How we can distinguish carbon monoxide poisoning? So this is the way to detect. There are number of instruments also. Here also you can see there will be chest pain, headache, vomiting, dizziness, upset stomach, weakness. Okay, these are some of the symptoms of carbon monoxide poisoning usually. Okay, that is regarding the carbon monoxide poisoning. Then we have another topic, that is the physiological effects of smoking. Going to the physiological effects of smoking here, because smoking is now increasing among the youth of your age. Earlier there was not so much smoking. Nowadays smoking is again increasing. So what are the consequences of, or what are the health effects of smoking? So going to the smoking, basically it is affecting your lungs as well as your trachea and bronchus. These are the two areas where smoking can cause significant damage. So smoking can causes fatal diseases to develop in many parts of the body, including cancer of the upper and lower respiratory tract. Right here you can see the upper and lower respiratory tract means our trachea, then it goes down into bronchus, then goes into the lungs. So basically it will be affecting your lungs as well as your respiratory tract. So what are the areas? Mouth will be affected, nasopharynx will be affected, larynx will be affected, lungs will be affected, esophagus will be affected, and kidneys will be affected. So these are the areas where the health effects of smoking can be observed. Then smoking also increases the risk of cardiovascular disease. Cardiovascular disease means disease affecting your heart as well as your blood vessel. So those kinds of disease are called cardiovascular disease. Then aortic aneurysm. Aneurysm means bulging of aorta. That is a aortic aneurysm. Then Crohn's disease is a type of disease affecting your intestine. Gastric and duodenal ulcers will be there. Cataract will be there. Then another problem is that in your retina there is a central area where there is a maximum intensity of vision. That area is called a macula. Macula is the name of that area, and any damage to that area is known as a macular degeneration, causing a loss of central vision. It is at the center of the retina there will not be any vision. That is the meaning of the word macular degeneration. Then another problem with this physiological effects of smoking is that it can lead to chronic obstructive pulmonary disease. I will show you what is a chronic obstructive pulmonary disease. See, here you can see that. So in this chronic obstructive pulmonary disease, see, this is how it is affecting. See, this is the normal size of the your aorta, normal size of the bronchus. When there is this disease, the size of the bronchus will be decreased, so that lesser air can pass through that. That is the problem of the chronic obstructive pulmonary disease. Here also you can see that this is the normal size of this aorta, trachea and bronchus. So there is a decrease in the size of the size of this. Here also you can find that. So there is a gradual decrease here. This is another picture. Here you can see that. So this is the normal size. When the inner opening or inner cavities of this trachea or bronchus is gradually reduced, our body will not be able to transport sufficient quantity of oxygen, and that will lead to this situation known by the name chronic obstructive pulmonary disease. It is commonly known by the name COPD. Now in this COPD, it is a disease which usually caused by tobacco smoking itself. There are there could be other reasons for this disease, but the most prominent reason for is the tobacco smoking itself. So here you can see that what are the important factors affecting. So these are some of the important risk factors. Then what are the going to the COPD? Here you can see that it's a permanent lung disease that obstruct airflow. So obstruct means block, and there are many complications are there. Emphysema can develop, and finally what happens, this is how when healthy lungs will be observed. Now in this chronic COPD, after a period of time it will be gradually deteriorating, and finally there is a significant damage to the alveoli. So this is the features of COPD, and COPD is a very dangerous disease, and it can eventually lead to death of the person. Then another so it's a very the obstruction is usually progressive and not reversible. That is, once this obstruction has taken place, it is not easy to reverse it or undo that damage to the trachea or to the bronchus, and does not change markedly over a period of several months. So exposure of infants and children to passive smoking increase the risk of wheezing. Wheezing means what is the meaning of the word? I will tell you. Wheezing. Wheezing is actually a difficulty in breathing. See, wheezing, this is what we call wheezing, a high-pitched, coarse whistling sound. So that is very difficult type of breathing, and that is known as that is known by the name wheezing. And this is how the people experiencing wheezing is usually exhibiting. So that is regarding the exposure on children. Then it can also cause asthma attack, then cough, as well as lower respiratory tract infection like bronchitis and pneumonia. And I will show you how asthma is working. Asthma is also similar to this COPD. In this asthma, here you can see that what happens in this asthma. This is basically what is happening in asthma. See, here you can see that this is a normal air passage. Now in an asthmatic patient, there is a shrinking of this air passage inside. Okay, so what doctors are doing is that you might have noticed that these people are inhaling a gas. When they are inhaling gas, this opening will dilate, so they can easily take air into their lungs. So this is the problem with the asthma. Asthma is basically a shrinking or shrinking of air passage or trachea, as well as the bronchus. Here you can see that this is also asthma. This is how the asthma is normally working. See here. So you can look that in an asthmatic patient, the trachea as well as the bronchus will be smaller in size because of this shrinking of this air passage, and that will be leading to a situation in which a person may find very much difficulty in taking oxygen into its lungs. So that is known by the name asthma. And problem with the children is that In the case of children, the smoking can lead to asthma. So that is one situation. Then it also causes lower respiratory tract. Lower respiratory tract means bronchus. This is the upper respiratory tract, and then it is again divided into two, and the lower one is the bronchus. Then pneumonia, then bronchitis. I will show you how bronchitis is appearing. Here you can. This is the symptoms of bronchitis. You might have this actually. This is the, where is it? Bronchitis, a good picture. So this is a basically a symptom of bronchitis. See, this is the trachea, and it is dividing into two, and this is known as a bronchus. Now, in a person with bronchitis, this is the situation. There is a swelling or inflammation inside the bronchus. That inflammation inside the bronchus is known by the name bronchitis. So sometimes when you take children to the hospital, doctor, they may say that he or she is having bronchitis. Bronchitis is basically this situation, inflammation of the bronchus. Itis means inflammation or swelling. Inflammation of the bronchus is known by the name bronchitis. So that is what is happening in the case of children. It can lead to asthma, it can lead to bronchitis. Then there is one more disease that is known as a pneumonia. And what happens in a pneumonia is that pneumonia is a disease affecting your lungs. See, this is how the pneumonia is normally happening. In the case of pneumonia, there is this is the situation. What happens is that, let me see. So here you can find that this is a person with a pneumonia. See, one side is a normal lungs, other side it is filled with a lot of body tissue fluid, so that the lungs of the person may not be working properly. So this is the pneumonia. Here also you can find that. So this is a person affected with the pneumonia. This is how see, this is another picture. See, the lungs is filled with a lot of water. So that is what is happening in the case of pneumonia. See, the inflammation. See, this is how the normal lungs will be there. Now in a person with a pneumonia, there will be a lot of fluid accumulation. When fluid accumulation is taking place inside the lungs, the person may not be able to breathe air, or it can also able to transport air. So here you can see that what is pneumonia is stated as an infection wherein air sacs present in the lungs get inflamed. So that is basically a pneumonia. Here you can see that these are the small air sacs, and there is an inflammation of these air sacs. It is known by the name pneumonia. Pneumonia is basically therefore affecting your alveolus. Here you can see that the normal alveolus, how it is appearing, and when there is a pneumonia, there is swelling or inflammation, and it is usually a bacterial disease. And the bacterial disease is leading to this situation. Here also you can find that how a normal alveoli as well as a person with a pneumonia is having. So the reason why the pneumonia is affecting is that it is due to a bacterial disease, and this bacterial disease is causing fluid and blood cells to accumulate inside the alveoli, and when fluids are accumulating inside the alveoli, the lungs may not be able to perform its normal function of air exchange. So that is what is happening in the case of pneumonia. Then it also smoking can also increase acute chronic middle ear disease. So the diseases affecting your one is outer ear, middle ear, and inner ear. So there can be number of bacterial infection and other type of infection that affects your middle ear, and that is known as a middle ear infection. Then, as we have already told you, the smoking can precipitate means increase asthma attack and also their severity. So if a person with a tendency of asthma, if he or she is smoking, it can increase their chance of developing asthma more frequently. New evidence indicates that onset of asthma in adults may be induced by passive smoking. What is passive smoking? When a person is smoking, if one person is smoking here, he is directly taking air into his mouth, but we are all getting the air. So that is known by the name passive smoking, and passive smoking can be as dangerous as active smoking. So risk of pneumonia is increased by irritant effect of smoke inhalation accompanied by mucus gland hypertrophy. See, I will show you some effects of smoking. See what happens. Here we will see if there are any pictures showing effects of smoking. See, these are the basic effects of smoking. See, tobacco, how it is affecting. It can affect your oral cavity, cause oral cancer. It can affect your lungs, called lung cancer. It can cause bronchitis, emphysema. It can cause what is called. It can affect your intestine, causing intestinal damage. Then respiratory, then throat. It can affect. So many parts of the many parts of your body can be affected by this smoking. See, lot of problems are there. Like, see, almost every organ in your body can be affected by smoking. See, here also you can find how the tobacco smoking can affect. So these are all some of the harmful effects of smoking. See, let's see if it is a higher. See, here it is causing brain damage, it is causing lung cancer, stomach cancer, cervical cancer, weakness of your bone, blood clotting on your legs, infertility, diabetes, bronchitis. So it is plenty of consequences are there because of tobacco smoking. That is why doctors are always advising to quit smoking. But nowadays, what is happening among the younger generation of your age is that even though people are knowing that it is harmful, just for some momentary pleasure or just to escape from some normal tensions or other thing, they are going to smoking. So that is the problem that youth are facing now. So it's very important that you develop a system in which you are now going to enjoy the happiness in your life. At the same time, you know how to deal with the difficulties that are coming in your life. So if you don't know how to handle difficulties in life, these are some of the easy escape mechanism people are smoking. If most people who are smoking or resorting alcohol, they don't know how to handle difficulties in their life, how to handle crisis in their life, how to handle failures in their life. So these are the people who are usually going to alcoholism, drug addiction, smoking, etc. Because these all give them an opportunity to temporarily forget about their difficulties. That is why they go into this kind of. But it is only creating further problem. Even though they are for a temporary period in their life, they may be unaware of the difficulties of life, but in their future life they will have more problem because of smoking, drug addiction, as well as alcoholism. So best strategy is that learn how to live properly, and that is one thing that we have to, that people at your age should know how to live. What are the things you should know to lead a happy life? And one thing that I want to tell you is that if you are reading the stories of great people, then they all give a lot of good advices, and their lives can be motivating for you to handle this sort of crisis. So today we have a lot of time remaining, and I am not going to start a new topic today.